2013, the International Agency of Research on Cancer classified outdoor air pollution and particulate matter of 2.5 micrograms per cubic meter or PM2.5 in outdoor air pollution as carcinogenic to humans. But the effects of air pollution exposure may take 15 to 20 years to be reflected in the lung adenocarcinoma incidence rate. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and today I'll be talking about air pollution, which may be included as risk factor for patients with lung cancer who have never smoked. To assess the connection between pollution and lung cancer diagnosis, Renelle Myers and team compared the cumulative 3-year versus 20-year exposure in females with newly diagnosed lung cancer who have never smoked. The researchers collected detailed information on the patient's age, sex, race, country of birth, age of arrival in Canada for foreign-born Canadians, their occupation, family history of lung cancer, and secondhand smoke exposure. A detailed residential history from birth to cancer diagnosis for residences within Canada and prior residences outside of Canada, foreign-born immigrants were recorded. Cumulative exposure to PM2.5 was quantified with a high spatial resolution global exposure model. The magnitude of 3 years versus 20 years exposure were compared. Myers acknowledged that even a 20-year cumulative exposure does not capture childhood exposure and is an underestimate of lifetime exposure and depends on countries of residence. Of the 236 female patients with lung cancer who had never smoked, 83.3% were foreign-born, 71% were Asians. The mean years lived in a foreign country was 37.3 years. The mean age of lung cancer diagnosis was 66 years. 92.8% of them had adenocarcinoma and 55.9% were stage 3 or 4 lung cancer. For foreign-born Canadian females, only 2% had 3-year cumulative PM2.5 exposure of greater than 10 microgram per cubic meter, whereas 20% had a 20-year cumulative PM2.5 of greater than 10 microgram per cubic meter. All had a PM2.5 exposure greater than 5 microgram per cubic meter. Our study demonstrates the importance of incorporating long-term cumulative exposure to ambient air pollutants in the assessment of individual lung cancer risk in combination with traditional risk factors, said Dr. Myers. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.